mental health more than the physical health which the patients were presenting with. And this actually happened mostly when I was, specifically when I was at National Spinal Injury Hospital, where I dealt with patients who had lost their sense of movement. They could not move, walk, they were spine injured. Mostly were from traumatic events like road traffic accidents or falls. And I saw patients just come, a healthy person who was up and about doing their own thing. Suddenly you're in a road accident and you're told you can't walk, you'll never walk again in your life. And some dramatic cases would actually lose hope and lose their lives in a very short time. I saw one lose their lives in a record 4 weeks. And that taught me that there was more really to physical health. While others I saw who would get help and manage even in their condition. So that's how I ventured into the field of mental health, and I have been happy to be there since then. So this afternoon, to discuss with all of you about the place of mental health from that time to now, and the experiences I've had is quite an honor. I'm glad also that SECU is prioritizing mental health because it's a very integral part of health for everyone, especially for their staff, their students, and the community, because as an higher education institution, everyone is looking upon you to give direction on the way to go in matters mental health. So this is very good to see that we are taking mental health quite seriously. And when we are talking about mental health, it's good that we are in the same field to see exactly what we are talking about. And mental health, we say it's that state of wellness where you find yourself that you are able to experience the full potential of your abilities. You are able to manage with the normal stresses in life, and then with that you can now contribute well to your society. So the main aspects of mental health, when we talk about mental health, we're talking about your emotional health, how you feel, how you handle your emotions. And then we're also talking about your cognition, how you make your decisions, especially how you cope with challenges when they come to your life, because as we know, life is full of challenges. And then with this, it's also the social well-being, how you interact with the people around you. So, and how you contribute productively to your community and to your society. These are very important aspects of mental health, and this is what we're talking about. So you can see when somebody is not mentally well, then they are affected all around. Their emotions, their contribution to society is affected. And that's why we say mental health is a key determinant to the overall health and the socio-economic development of every community, because now it influences both the individual and the community outcomes. Like if you are sick, the example I just gave about my experience with working with patients at the National Spinal Injury Hospital. If you are sick, how well you are able to recover from your illness and come out to contribute to society is determined to a great extent by your mental wellness, how well you feel inside. Your social development, even academic achievement, if you are going to go to university or if you're going to grow when you are there, the kind of attainment you're going to get with your education is very highly determined by your mental wellness. We have seen students who are quite intelligent, students who have a lot of potential, but unfortunately they encounter challenges with their mental health, and most of the time they will either take long at the university to finish their education, or they will drop out of the university, and this will have an impact on the overall success in life. So mental health cuts across, and it's very important to focus on it. So when we are talking, because I was asked to talk about mental health and mental well-being or mental wellness, what is mental wellness? And I've said their mental health is not about what you have, it is something you practice. So the well-being, mental well-being is an overarching area or idea where you practice good habits on a day-to-day basis. You also are pursuing a certain goal. You are working towards a goal. So the things you do, are they goal oriented? What is making you do what you do purposely? So that state, when you find yourself making choices on a daily basis which enhance your well-being and those around you, as we've said, then that is what we call mental wellness. So basically, I want to say mental health has evolved over time. And with this, also the well-being of human beings have also evolved. I've said mental wellness has been a key determinant to your overall social and economic development, and also influencing the individual and community outcomes. So it has evolved over time, and I've just given an indication of where we've come, the human lineage, how we have evolved. As humans have evolved right from the beginning of our ancestors and Anthropithecus to where we are now, the Homo sapiens. So with all this, our mental wellness and our mental health has also improved. We've come a long way. Why? Because initially, in ancient times, mental health was not well understood. And people who had mental illness suffered a lot at that time. It was seen as the work of supernatural. If you had abnormal behavior, you were thought to be possessed by demons, or the witches or gods were taking control of the people. Humans always try to get explanation for these things, but it was seen that you are not a good person. You are demon possessed, you had evil spirits. Sometimes you are just seen as a weak person, and sometimes they would not even believe that you are actually sick. They thought you are imagining the problems. So we've come a long way since that time, and these things have been documented. When we go through history, we'll see that symptoms of mental illness have existed for a long time, actually. Right from the time of the Greek, who are the people who have documented a lot of what we know, history, the Greek philosophers, they have initially documented symptoms which were bizarre, which were not well understood. Some of the main diagnoses which people noticed then was what they would call hysteria, or they were calling neurosis. And as we've said, it was being seen as being possessed by demons at that time. But one of the main persons who documented the earliest initial documentation we have was a German psychiatrist who was called Emil Kraepelin. Until around the year 1883, he published symptoms of mental illness, which he said were more biological and genetic malfunction, as opposed to the demon possession which was being propagated by people at that time. And with this, then doctors of the time went now to try and understand the biological and genetic malfunction of this mental illness. So since that time, a lot has been achieved, a lot of research has come, and from that time now, mental illnesses started getting diagnosis. It was being called mental hygiene at the time, as opposed to physical hygiene. People are being seen like they were dirty in their mind. Their mind was not clean. So diagnosis now started coming out, including depression. People could see this was depression. People could see it was anxiety. Alcoholism was there. What we call post-traumatic stress disorder, or the problems you get when you have been through very difficult times. And because of that, now they started looking for ways of treating patients. Because initially, when it was not well understood, when people who were at bizarre behavior were thought to be demon possessed, most of them were cast out, or they were just left to their own devices. Where families were more caring, these people would just be taken care by their families, where they just kept them warm and waited for nature to take its course. But because these symptoms were more and more and more people were showing signs of problems, then they opened what they called insane asylums, especially in the US and in Britain. These people were actually even put in prisons. They were just removed from society and locked up somewhere. When they were locked there, nothing much was happening. They were just being removed out of, because they were seen to be people who were they were even what can I say? They were not fit to be in society. So these people were put aside, and the society was left to go on as usual. But with time, they wanted to find out what they could do about the people who are not functioning well, and traditional ways of helping them came, using traditional means like acupuncture, using traditional herbs. Sometimes they used to use exorcism to get out the evil spirits, and even drilling holes so that they could let out the spirits who are thought to be in the brain of the people. So basically, treatment of mental illness has come from very far to where we are. Women then, because the disease of hysteria was more common in women, and that time they used to believe that hysteria was because the uterus of women was moving all over the body. So women were even being encouraged to take care of their uterus by getting married, because mostly it was for young people who are not married, and engaging in sex as a way of treating mental illness at the time. So we're saying since that time things have improved, and in the 19th and the 20th centuries we have had mental health hospitals now which are more humane. They used to treat patients better with dignity. There was now use of what we call antipsychotic drugs and other medications. People started realizing really mental illness was a biological issue, and it could just be treated as they were treating physical diseases. Then there was also what is called the ECT, or electroconvulsive therapy, which is still in use even up to today for severe mood disorders, including depression and anxiety. Around the same time, in the 20th, 19th and 20th century, there was also surgery being performed. They would see sometimes mental illness was as a problem with the brain, some part of the brain, and then they would want to remove that part of the brain to see if the person would get cured. And then as the 20th century came, by mid 20th century, then they started seeing these people, when you talked to them, actually some of them got better. So this thing of talking cure, which is today's psychotherapy, started taking root, because at that time now there are more people who are advocating for mental wellness and humane treatment of these people who are suffering from mental illness. So we've come from far, and now here we are asking, how does mental health care look like in our times now in the 21st century? And what we have seen is that there has been a lot of modern research which has bridged that ancient mentality with modern care. Now we know mental illness is not about demon possession. We know it's not about the person being weak. It's not the person imagining what could be happening to them. So now that ignorance has been replaced with knowledge. and superstition has been overtaken by science. There's a lot of research which has been done. So now we have treatments which handle people who are mentally well with a lot of knowledge. They are effective and a lot of morality. They are treated as people who have their own human rights, and their human rights are respected. We are also seeing more and more people, including myself here, who have dedicated themselves to the management and treatment of patients with mental illness and supporting their families. And programs have come. We have up-to-date programs. We know now, like people who have alcoholism, we know what to do with them. People who have brain disorders, they have depression, we know now what medications to give. So we've come a long way. And this, especially since 2020, right from 2019, mental health has taken quite a central place in the world stage. Because with COVID-19, we saw very quickly how the environment and physical health could interact with mental illness and mental health. So the world over, there was a lot of anxiety when we started seeing the stories of how COVID was spreading right from the West. There was a lot of anxiety. It was devastating, and the shock, the depression, people, the losses they suffered from. So all this made the world see that there was need to be more intentional about mental health practices. Even as institutions of higher learning, there have been a lot of research to see how is mental health impacting or impacted by physical health, especially now that we have COVID-19. The governments have had to improve infrastructure. Even the government of Kenya set up a committee to look at the mental wellness of the country, something which had not happened for a long time. We got a task force to look at the mental wellness, to advise the government on what it can do to take care of the mental wellness of its people. And with this, we have seen improved financing for mental health services, a lot of awareness sessions and sensitization, like what we are having now, and especially campaign against stigma and discrimination, because from what we have seen, why people were getting isolated when they were sick in the initial time was because of stigma. This is not completely gone, because even today it's very difficult for families to really agree that their family member is suffering from a mental illness and they need to seek treatment. And mostly this is because of the stigma associated with having mental illness. Because of the history of where we've come from, it's not been very easy to accept that mental wellness is an issue. So where are we at the moment, and what determines the mental state of our condition, of our nation? And we're saying nowadays there are several conditions in the places where people live, where they work, where they learn, that affect a wide range of the health risks and the outcomes of mental illness in the society. And now we are looking specifically at the economic circumstances of people. From what we have said is people who are mentally sick, they are economically disadvantaged, because their well-being, even their attainment economically, socially, is curtailed. They rarely reach the highest potential to contribute meaningfully in society. Especially people with severe mental illness, we realize that they are unable to hold jobs or to even work on their businesses or economic activities to take care of themselves. And also there has been a lot of discrimination for people with mental illness. If you're looking for an employment and you tell your prospective employer that I suffer from this particular type of mental illness, you may lose that opportunity to be considered for the job. So I've borrowed here from the ecological model, just to show that the determinants of mental health are quite cross-cutting. Right from the individual themselves, this is the activities you practice in as an individual, the community where you live, and the larger economic environment where you are, if you are able to work, and the country as a whole, up to the whole world. What is happening across the world actually determines the mental wellness. You may think we are far off, but it will get to you where you are. So physical environment is very important because especially people who are now living in enclosed environment, we've seen lack of green spaces. You have this feeling of being clouded, even in your head. You cannot think well. You don't have places for physical exercise, for example, or to walk around. Insecurity, sometimes you've seen people, even as you try to get physically active, you want to walk or to run, we've seen people running and they're attacked, their things are stolen or they're armed. So all these things determine your level of mental wellness. The social connectedness, because where you stay, the people you interact with have a big impact on your mental health outcomes, because people are social beings, and that's why we said one of the hallmarks of mental health is being able to contribute gainfully to your community. And then also the kind of food options we have. When we're talking about mental wellness as an individual, you need to be purposeful about healthy eating, taking care of yourself, what we call self-care. Taking care of yourself, physical fitness, spiritual fitness, just keeping busy and keeping healthy is very important. Sleeping well, keeping a schedule, all these things are determined by the environment where you find yourself, and they determine how mentally well you can be. So basically, there are many things which are nowadays influencing the mental wellness of individuals and the community at large. And I've come here to ask now, from where we are, what is the future of mental health? Unfortunately, I do not have a very optimistic and this view of the future of mental health, but with more understanding what we have seen, now we understand mental health better, we understand ourselves better. With all this sensitization, we understand why it is important to take care of our health, mental health especially, what we are calling self-care, where you need to take time to rejuvenate and to make sure you are physically and mentally well, because you can only give what you have. You can only pour from a cup which is full. If you've not taken care of yourself, then you're going to be easily triggered and you're not going to deal well with the normal stresses in life. So with this understanding, we expect that the place of mental health in the future is going to be better. Unfortunately, what we have also seen is the more we understand, and given the kind of enlightenment we have, then human beings have become very imaginative. So we know what we have, we know where we need to go, but we still want more. And sometimes with this wanting more, wanting much better for ourselves, can be quite a challenge for the mental well-being for now and going into the future. I also see, I said I'm passionate about using technology to reach and to sensitize and to prevent mental illness. So going to the future, I see that people are going to embrace telehealth programs, what we call mobile health. Like now, what we are doing, we are using telehealth to give sensitization programs for people where they are. So with this, there's going to be more awareness. There's going to be more rich options of how you can get help. Now I can talk to somebody who is in Mombasa, somebody who is out of this country, somebody who is in a remote area, like my village, using the telephone. We can talk, and where they need help, we can help. Initially, this was not possible. And now in the era of artificial intelligence, where now we have machines which can even tell when you're about to get unhappy, or can tell you when you are getting anxious, so that you can seek help, or it can direct you on what to do. I see this may make mental wellness better and help to improve the mental wellness of human beings going into the future. Also, with now this understanding and awareness, we are seeing, we expect less stigma and discrimination, so that now there are fewer barriers to seek help. We expect the more we mainstream the discussion on mental health, then more and more people will be emboldened to come out and seek help for their problems. So the cases of documented mental health problems may come up, but also comes up the opportunity to help people seek help and to help them get better. We are also seeing with advanced research, now there are more medications, there are more drugs available. We understand the disease process better. So I'm looking into the future, this can only get better, and we get more improvement in mental health. We're also seeing a lot of advocacy on mental health services. So we expect that things will get better going forward. However, with the increased use of social media, we are seeing that the cultural values we had, especially from Africa, from Kenya, where we are now, we are losing those social connectedness, because most of the time people are on social media. This has brought down the need for face-to-face or interpersonal interaction. So we find that we really don't need to meet a lot. And we've seen social media and technology cannot take away the need for that personal interaction. There is need to interact interpersonally. There are some things which we know we cannot gain using artificial means of connectedness. So some people are going to be isolated. There's going to be loneliness. This one is expected going into the future, because now we talk like this, I may not even feel the need to go and visit my aged parents, because maybe I talk to them every so often and I feel like I have seen them. So they may tend to be lonely and isolated because of the issues where we find ourselves going forward. So these are things to think about and to take into consideration as we advance into the future, because we are seeing, like now there's been a lot of reports about increased cases of suicide, increased cases of homicide, people killing each other, violence in the homes, especially when people have been locked in because of COVID-19. There's been a lot of violence in our homes. Some of these are because of mental illness, which may not have been diagnosed, or people have not sought help. So these are some of the challenges which are likely to get more, because from what we are seeing, even with this pandemic, we don't know how this pandemic will go on, and we don't know what are the long-term effects. So things may not get very good going to the future, but we have a lot of hope and optimism that the enlarged space with research and new understanding may make us cope better, even with the newer challenges we are likely to encounter going into the future. So I think I will want to stop there and pass it back so that we can reflect and we can have this discussion coming from the participants on how we can improve our own mental health. So I leave it here with a point of reflection as an individual. How do you take care of your mental health?